Hello, everyone, and welcome to this audio podcast. This is an audio podcast aligned to the Labostix Intermission. This is an audio podcast in regards to research and inclusion, and aligned to another Storm Labostix production. Those who have been listening, who've been checking out the audio podcast that will perhaps be a sort of the understanding that there had been an audio podcast as a previous sort of intermission, another Labostix intermission in around research involvement and participation. This audio podcast will look at some aspects aligned to that, but also and also in aligned to research and inclusion. So some works had been aligned to this theme, aligned to this theme in and around research and inclusion, in around research and inclusion, wherein works had been put forward aligned to health service research UK previously or retrospectively. So I'm going to highlight in context some aspects in and around that. The basis of this sort of intermission is where I look to highlight aspects of research and inclusion in context of providing some aims and objectives, a bit of introduction, some perspective in around culture and perspective in and around what is known surrounding research and inclusion. Some aspects in around involvement and inclusion, from a scientific or research basis. Some aspects around the literature, and then some aspects around sort of best practices, and there will be some highlighting regarding to sort of further reading as well. So some aims and objectives to begin with. So to highlight how important the aims and objectives are wherein there are two main aims and objectives and around this. Initially to highlight how important it is for inclusion to research in context of research and inclusion to bridge areas of language and health literacy for patients undergoing particular and specific health conditions, and two, or subsequently to highlight if inclusion through involvement or research involvement or research and inclusion efforts can be helpful and be integrated as part of routine healthcare, providing a particular perspective. So here goes. So a bit of introduction. In the UK, the UK government had emphasised the importance of improving healthcare outcomes and providing smarter patient-centric care. There's works by Petsulas and team in 2015 that delve into aspects surrounding this. Such initiative would be supplementary to care that already exists. For example, as part of as part of, for example, as part of electronic patient records or EPRs. There is now an ever more need to improve health integration for people with particular long-standing conditions or long-term conditions. This remains as perhaps one of the most important challenges facing the National Health Service or NHS, and um, and uh, and uh, and particularly as a society. And there's works that have been documented and evidence in a King's Fund report, sort of retrospectively in 2013. With sort of advances in around point of care, improving care for people with long-standing condition and long-term conditions must involve a shift from a reactive, disease focused and fragmented model of care towards a more proactive, holistic and preventive, wherein people with long-standing conditions or long-term conditions are encouraged to play a central role or centric role, and seek to take sort of ownership. And again, there's documented and evidence works in the King's Fund report from 2013, and there is also works in the King's Fund report evidenced and documented sort of more prospectively in one of the King's Fund report in 2018. So by encouraging sort of the educational aspects and in regard to context across a range of health disciplines or specialities, this would also reduce this could also reduce could also reduce inequity, increase literacy and language, and improve overall healthcare in and around, for example, the a particular health condition or healthcare condition in and around chronic kidney disease or the CKD population, the chronic kidney disease population or CKD population. Now, to provide a bit of perspective, a bit of perspective in around culture and perspective. So the National Institute of Care Excellence and the KDIGO guidelines have outlined epidemiology of chronic kidney disease in and around the UK. Although again, when the National Institute of Care Excellence or NICE is in around the UK, in around recommendations in particular aspects of healthcare in the UK. KDIGO is specific to guidelines and practices and recommendations in around aspects of kidney care practice, across different areas, and focuses around kidney care practice in the United States. That being said, the incidence rate of chronic kidney disease in the UK, at least in 2013, increased from 109 parts per million population to 115 parts per million population in 2014. The increase was seen mainly in England, where Scotland had fluctuating rates since fluctuating rates since 2008. And this incidence rate includes Northern Ireland and Wales. Ethnicity was a variable factor, or has been a variable factor, where the median age for white incidence patients was 66.4 and 58.7 for non-white patients. In almost 2 decades since the UK government published the document, The Expert Patient, a new approach to chronic kidney disease management for the 21st century, the intention was that service users would lead others by example, being experts in disease management. And there is a document dating back in regard to some aspects around this by the Department of Health in the early 2000s. In the early 2000s. Although the initiative was published in the United Kingdom, uh, 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 although initiative has been published in the United Kingdom, in Australia, works by Hughes and team in 2018 identified where expert patients in CKD recognized areas of development related to good quality information. There was an issue, however, around the provision of appropriate culturally aware information and known who to contact for help. And this was especially important in remote communities with limited access to healthcare. The inclusion of expert patients or service users is not wholeheartedly reported in literature. So what is known? So the clear hierarchy of occupations established through the growth of hospital medicine is is attributed to as a major contributor to commissioning and the dominance of medicine in the structural and cultural sort of isolation of the healthcare workforce. And this works by Nelson and team 2015 and Pillimer and team in 2016 that sort of document and highlight hierarchy or structuralisms in and around healthcare and practice. International experience in planning funding care for patients with long-standing conditions or long-term conditions confirms different approaches need to be explored. And in this context, allied health professionals or AHPs and involvement like research or involvement research at primary care level has not been documented and has not been documented and has not been stratified. The structural and cultural isolation by clinical care groups is focused on making small but marginal service changes, for which the effort involved does not always appear proportionate to improvements in services with a focus on patient-reported outcome measures. And this works sort of retrospectively from Rydurch and team in 2002 and Robin and team in 2009. So in context of inclusion now, inclusion. So the online space can be important. This allows exchange of knowledge, approaches, recommendations, and information which reflect the patient expertise, which have gained, which have been gained, which patients can gain or seek to gain potentially through lived experiences, for example. Now, patient participation in making decision is encouraged in healthcare, but patients at the same time there's little practical support obtained from health professionals themselves. Access to internet by patients or online by patients, for example, has a positive or can have a positive impact surrounding trajectory. Those with more so this then brings in the aspect context in regard to those with more education or higher incomes, for example, are more likely to seek seek out healthcare related information online, at least the end of at least where evidence indicates. The age, length, and time of time since diagnosis and stage of disease or a disease in context are not associated with use of online or by or the use of the internet or online approaches by patients. Parents in this context seek out information, for example, about a child's condition, or may seek out information surrounding a child's condition and study and a study by author Van Dam and team in 2017 highlighted or indicates that 94% 90%, 94% of parents find the internet useful, sourcing baseline for baseline information in around specific and particular areas of health and medical and clinical practices. The internet has some advantages and effects to increase patient empowerment, but at the same time, unfortunately, can also lead to misinformation. So this then brings into where threads for example threads or discussions through social media and online forums can help identify clinically and non-clinically relevant context as well. So in context in aligned to research in aligned to research and research and aligned to sort of aspects of inclusion now. So electronic patient records or EPRs access has many advantages, but patient enthusiasm and use have been variable. There's reports from Phelps and team in 2014. There's reports by the Royal College of Physicians more retrospectively in 2007. The more successful systems have provided information that patients or relatives need usually in the setting of chronic kidney disease, chronic disease or chronic in the setting of disease, specifically emergency in and around emergency or usually in the setting of chronic kidney disease, emergency or pertinence. And again, works by Phelps and team in 2014 have delved into some aspect into in that context. Variation in uptake in context of electronic patient records or EPRs has been related to, for example, social factors potentially and concerns have been expressed about a digital divide. There's works from Stowe's and team in 2010 that delve into this, and the cost in relation to utilization and health outcomes. So, for example, works by Phelps again in 2000, Phelps and team in 2014, and Stowe's and team again in 2010 highlight some aspects in and around this. And so, whilst clinicians have reported that consultations, for example, with patients have changed owing to the use of electronic patient records, patients ironically still have questions surrounding different aspects of practice practices or healthcare practices and approach to aspects of healthcare. There's works by Sarkar and team in 2010. There's works by Mohammed and team in 2020, Mohammed and Headley in 2019, and also Mohammed and team in another paper, another works in around 2020 as well. Now, in context of chronic kidney disease and specifically chronic kidney disease, CKD patients tend to have to go through various stages of the healthcare journey. One team informs of how effective it can be for health professionals to use online spaces for education and MDT involvement or multidisciplinary team involvement. Allied health professional in context in alike to this and in context as well, allied health professionals tend to be at the forefront in some aspects of accessing evidence-based medicine frameworks surrounding multidisciplinary teams and involvement related research including science data and remote health and aspects surrounding remote healthcare and healthcare research. And again, there's works by Mohammed and team in 2020 that have highlighted some aspects in and around this. So some aspects now, some context in and around what had been perceived as as a basis in and around best practice. So understanding health information gaps in patients with chronic kidney disease or CKD, require educational support to better understand aspects of healthcare and condition. More educational interventions are required to support best practice, and there's works by Zulman and team in 2014, and this could be achieved through collaborative working and through primary, for example, through primary care networks, or what's being referred to PCNs, and prompting allied health professionals, AHPs, to be involved at primary care level. And there's works by Jones and team in 2019 that look into that or delve into that. Patients, therefore, may additionally require supplementary education or educational advice or guidance to help steer clear of misinformation. And again, Mohammed and team sort of delve into this from 2000 works that were published in 2014, 2016, 2009, and also 2019. I want to say now thank you for listening in on this particular audio podcast. I like to the Labostix intermission in and around research and inclusion. And this has been another Storm Labostix production. Thank you for listening in.